Did you know that there are two medications that, when utilized together, can completely change the trajectory of erectile dysfunction treatment? This specific combination is currently capturing the attention of medical professionals and specialists all around the world, and it is not without reason. It has fundamentally changed the quality of life for countless men who are not responding well to the traditional, standard treatments for erectile dysfunction. If you are someone who has tried the famous pills, whether it's the blue pill or the daily 5 milligram options, and found that they either didn't work or stopped working over time, this information is crucial for you. We are going to explore what this duo is, why it has revolutionized the approach to men's health, and most importantly, the science behind why it works when single treatments fail. But we also need to ask, is it safe? Does it really deliver on its promises, or is this just another internet trend? Stick around until the end, because understanding this biological mechanism could be the missing link in your health journey. You might be surprised to learn that a significant number of men who do not respond to tadalafil actually have an underlying issue that the pill cannot fix on its own: low testosterone. In many clinical cases, correcting this hormonal imbalance can completely transform the results of the treatment. To understand why, we have to look at how an erection actually works. It is a common misconception that an erection depends solely on blood flow. While blood is the hydraulic fluid that makes the mechanics work, the process itself is far more complex. It depends on three major pillars working in perfect harmony: testosterone, the circulatory system, and the brain. If any single one of these pillars collapses or weakens, the entire structure of the treatment fails. You can have excellent blood flow, but if the hormonal signal is weak, the response will be weak. Let's break down exactly what happens inside the body to clarify this failure. Medications like tadalafil belong to a class of drugs known as PDE5 inhibitors. Their job is to block an enzyme called phosphodiesterase type 5. This enzyme is responsible for breaking down a molecule called cGMP. When cGMP levels are high, the smooth muscles in the blood vessels relax, allowing blood to rush into the penis. Essentially, tadalafil helps maintain the environment necessary for blood to flow and for an erection to be sustained. However, there is a catch. Tadalafil maintains the environment, but it does not create the spark. The molecule that kicks off this entire process, the one that tells the body to produce the nitric oxide, which eventually leads to that cGMP molecule, is driven by testosterone. Testosterone is what stimulates the production of nitric oxide, the chemical messenger that initiates the entire cascade of the erection. Without sufficient testosterone, the body produces very little nitric oxide. Consequently, the cGMP molecule is never fully activated or produced in high enough quantities. The result? You can take the tadalafil, and it might be present in your system, but it has no fuel to work with. Think of it this way. Imagine you have a high-performance sports car, like a Ferrari. That car represents the vascular capacity provided by tadalafil. It has a powerful engine and perfect mechanics. However, testosterone is the gasoline. You can have the best car in the world parked in your driveway, but if the fuel tank is empty, the car isn't going anywhere. It doesn't matter how much you tune the engine or polish the exterior. Without gas, it is just a statue. This is exactly why so many men report a very specific frustration. They say, the medication worked great for me 2 years ago, but now it feels like I'm taking a sugar pill. In many of these cases, the problem isn't that the drug is defective or that the body has built a tolerance to the pill itself. The problem is often a progressive decline in hormonal health. The car is fine, but the fuel tank has run dry. The treatment requires a reevaluation, not of the pill, but of the hormonal baseline. This isn't just theory. It is backed by robust clinical data. A classic study published in the Journal of Sexual Medicine in 2010, known as the TOTUS study, evaluated this exact scenario. Researchers looked at a group of men who had low testosterone and were non-responders to tadalafil monotherapy. These were men for whom the pill simply did not work. The results were clear and undeniable. The addition of testosterone to the treatment regimen brought a significant improvement in erectile function compared to those who just increased the dose of the pill. The study highlighted that the benefit was most profound in men who had clinically confirmed low testosterone, those in the range of hypogonadism or testicular insufficiency. Furthermore, a meta-analysis conducted in 2019, published in a major andrology journal, took this a step further. They analyzed 8 different studies involving over 900 patients. The conclusion was emphatic. Men treated with a combination of testosterone replacement therapy and a PDE5 inhibitor showed significantly better erectile function scores than those treated with PDE5 inhibitors alone. The statistical data showed that restoring the hormonal baseline allowed the vascular medication to finally do its job. So, how does this combination manifest in a patient's daily life? It creates a dual action effect. While tadalafil works on the plumbing, ensuring the vessels stay open and the blood can remain in the penis, testosterone works on the drive. Testosterone is responsible for libido, sexual desire, overall energy levels, penile sensitivity, and even mood. When you combine these two, you're addressing both the physical capacity to have an erection and the neurological and hormonal desire to use it. It is a complementary action. When used in the correct dosages, specifically, the protocol often involves a daily, low-dose tadalafil of 5 mg combined with testosterone optimization. The benefits often extend beyond just the bedroom. This specific association has been shown to improve prostate health, assist with urinary flow issues, and enhance general vascular health. It creates a positive feedback loop. The patient feels more energetic due to the hormones, and their vascular system is optimized by the daily tadalafil, leading to a global improvement in vitality. However, we must pause here for a critical reality check. While this sounds like a miracle cure, it requires extreme caution and responsibility. This combination is not a one-size-fits-all solution, and it is certainly not for every man. Using testosterone when you do not need it, when your levels are normal, is dangerous. It does not provide superpowers to men with normal hormones. Instead, it can disrupt your body's natural balance. Unnecessary testosterone use can lead to infertility by shutting down sperm production. It can cause an increase in hematocrit, which is the thickening of the blood. Thick blood forces the heart to work harder and significantly increases the risk of cardiovascular events, such as heart attacks, strokes, and deep vein thrombosis. Therefore, the absolute first step before even considering this duo is a comprehensive metabolic evaluation. You cannot guess your testosterone levels. You must measure them. This means a full blood panel including total testosterone, free testosterone, LH, luteinizing hormone, FSH, follicle-stimulating hormone, prolactin, estradiol, liver function tests, cholesterol profiles, a complete blood count to check hematocrit, and PSA to check prostate health. Only in the presence of a diagnosis of hypogonadism, which requires both the laboratory evidence of low testosterone and the clinical symptoms of deficiency, is a man a candidate for this combined therapy. It is a medical decision, not a lifestyle hack. Now, I realize that for many of you, the idea of daily injections, expensive blood panels, and the risks of cardiovascular side effects is a deal breaker. You want the performance, but you don't want to gamble with your health. If you are looking for a way to naturally reignite that fuel we talked about, boosting your nitric oxide and cGMP levels, without needles or prescriptions, there is something you need to see. There is a bizarrely simple 7-second home ritual involving a specific purple tonic that is helping thousands of men reverse the root cause of ED and get back to their prime performance safely. Take out your phone right now and point your camera at the QR code on your screen. It will take you to a short presentation explaining exactly how this natural remedy works to eliminate the boner-killing enzyme that pills only mask. If you can't scan the screen right now, don't worry, I've also pinned the link to the top of the comments section below. Go check that out if you want a powerful, natural fix. The modern medical approach is shifting away from simply treating the symptom. We are no longer just looking at the failure of the erection. We are looking at the man as a whole system. We have to consider hormones, sleep quality, circulation, nutrition, and mental health. All of these factors are interconnected. When we balance these physiological factors, the results tend to be far superior and more sustainable. Tadalafil and testosterone, when used with the correct indication, strict medical monitoring, and common sense, can restore not just an erection, but a sense of vitality, energy, and well-being. If you found this deep dive into the science of men's health helpful, please consider sharing this information with someone who might need to hear it. Remember, accurate information is a fundamental part of effective treatment. Stay tuned for more science-backed insights into your health.